Hey, y'all. Welcome to Questions You Didn't Ask. Did you know that this very spot could be showcasing your business or event? Whether it's an audio ad on our podcast or a visual ad on our new YouTube station, or even both, we've got the space for you. Niasha Fray Consulting is reaching a growing audience of over 1,000 leaders who are passionate about health equity, social justice, and civil rights activism. These are professionals just like you, working across higher education, research, healthcare, nonprofit, government, and even public health sectors. If you're ready to get your message in front of a dedicated and engaged audience, send me an email at Niasha Fray Consulting, LLC at gmail.com. Let's talk about how we can help you connect with the people who need to hear about your services and products that advance health equity and wellness. Don't miss out. Get in the mix and let's make an impact together. Hello, and welcome to Questions You Didn't Ask. I'm Niasha Fray, CEO of Niasha Fray Consulting, LLC, and your host of this show. I'm really glad you're here because today we're kicking off a very special series, Doing It for Ourselves, Black Women, Salons, and the Science of Health Equity. Let me tell you why this series matters to me and why I think it matters to you. My career started in HIV research at the University of North Carolina at Chapel Hill School of Nursing. When I saw the chance to join the team at the HEEAT Lab at Duke University School of Nursing, working on the Updo's Protective Styles Study, also known as Using PrEP, Doing It for Ourselves, it felt like a full circle moment. At Niasha Fray Consulting, we build community-informed solutions to health equity challenges. The HEEAT Lab's mission, addressing health disparities through equity, engagement, advocacy, and trust, aligns perfectly. They're doing real-world research in places where people already look for care, guidance, and trust. Salons and barbershops, community hubs, the spaces where Black women and men, and yes, families too, gather. And yes, some of you might be thinking, wait, HIV? Isn't that old news? Or we don't hear about HIV like we used to, especially after COVID. Unfortunately, HIV is still a thing. And that's why this matters. Here's what the data show. Black African American people make up roughly 12% of the US population, yet they accounted for 38% of new HIV diagnoses in 2022. The US South bears a huge share of this burden. In 2022, the South accounted for approximately 52% of all new HIV diagnoses, even though it's only about 38% of the population. Among women, Black women represent about 13% of US women, but account for around 50% of new HIV diagnoses among women. Prevention is possible. Daily PrEP, also known as pre-exposure prophylaxis, can reduce HIV risk by more than 90% when taken as prescribed. Yet in many Southern Black communities, for each new HIV diagnosis among Black people, there were only about 4 Black PrEP users. Now, compare that to about 27 white PrEP users for each new diagnosis among white people. The comparison is staggering, 4 to 27 between Black and white PrEP users. When you hear these numbers, you realize the challenge isn't just science or medicine, it's access, trust, design, places, people, leadership. And that brings us back to community health. The mix of programs, places, policies, and people that make a difference in a community's well-being. And health justice. The belief that everyone, no matter their zip code or skin color or income, deserves fair access to care, resources, and power to shape systems. We also have to acknowledge the historical backdrop. For decades, the U.S. healthcare system was segregated. Hospitals and clinics were designed to serve white and Black people separately under laws like the Hill-Burton Act. Broad enforcement of desegregation only came later via Medicare and Title VI. That separate and unequal structure left deep scars. Higher maternal and infant mortality in Black communities, more chronic disease burden, less access to research opportunity and leadership roles, and even higher risk of medical neglect or error in some settings. And leadership matters. Very few nurses have research doctorates. Fewer than 3% of all registered nurses hold a PhD or equivalent research degree. And Black nurse scientists are vastly underrepresented, in part because only a small number of HBCUs historically offered PhD nursing programs. Until we expand and diversify the pipeline, equity remains incomplete. Now, let me introduce two remarkable women who are leading the charge. Dr. Schenita Randolph is Associate Professor at Duke University School of Nursing and is the founding director and principal investigator of the HEEAT Lab. She is a nurse scientist, educator, and advocate dedicated to advancing health equity and social justice. Her research focuses on culturally responsive, community-driven interventions to address racial and ethnic health disparities, especially in Black families and communities. She has secured competitive national funding, is widely published, and is a fellow of the American Academy of Nursing. With the HEEAT Lab, she leads the work of turning research into trust, engagement, and lasting partnership. Might I add that Dr. Randolph recently received tenure at the Duke University School of Nursing. Congratulations, Dr. Randolph. Dr. Ragan Johnson is Associate Clinical Professor and Project Director of LEAP, known as Leading to Equitable Access to Health Professionals at Duke University School of Nursing, and co-investigator in the UPDO study. With nearly 20 years of experience, she combines clinician, educator, and scholar roles. Her work focuses on sexual health promotion in Black communities and innovatively uses space like salons and barbershops for outreach. Her scholarship was featured in the New England Journal of Medicine, and she is a national leader in equitable HIV prevention. Both of these women are among the few doctorally trained nurse scientists at elite universities who are leading large-scale community-based research initiatives. Duke University School of Nursing itself is globally recognized for innovation, leadership, and research excellence, making this team uniquely powerful. Over the next 4 episodes, we'll dive into how stylists become health navigators, how salons become sites for trust and prevention, how PrEP becomes accessible, and how Black women become leaders in their own health story. We'll ask, how do you build interventions with the community, not just for them? How do you link real-world research with lived experience? How do you shift power so that change is not done to Black women, but by Black women? So whether you're listening in your car, on your walk, or sitting in your favorite salon chair, get ready. Get ready to engage. Get ready to be inspired. Get ready to take action. Because this isn't just about asking questions, it's about changing the system together. Let's begin. Now that we have heard your illustrious bios and my audience is excited to hear more about the work that you do, I want to start out with you, Dr. Randolph. And, this is a question that I give most of my guests just so that my audience gets an idea of what motivated you to join us here today and have this conversation?
Well, first of all, thank you for having me. I think that it was definitely the goals and your vision for your podcast definitely align with me around, especially around equity and engaging people in conversations that are real conversations and questions that they may think about, but really don't have the safe space to have those conversations. So that was it. And of course, because it's you, Niasha.
Thank you so much, Schenita. I appreciate that. Dr. Ragan Johnson, tell us in a little bit about why did you say yes when I called and said, would you please join us in this conversation?
Yeah, so thank you again for inviting me and having me on. It's a pleasure to be here. And like Schenita said, because you asked, but also I've had the pleasure of listening to several of your episodes and seasons. And I just really like how you frame health equity in a different way, right? It's what we traditionally think about health equity and how you kind of weave in other topics, I think is really good.
Well, thank you so much for that compliment. You know, one of the reasons why I asked that question is one, because it helps people, of course, understand, well, why did she invite these people and why do they even want to talk to her about these things? But also to encourage other people that when you have a vision and you see people that you admire and you want to engage them in partnership and collaboration, sometimes it's just a matter of asking the question, right? And a lot of times you'll be surprised at the response that you get, even if it's a no for right now or a no, but I know somebody. Please lean into these conversations and opportunities for collaboration and partnership and collective action. So I've read your bios and shared with everyone who you are professionally, right? But I would love for you, and I'll start again with you, Dr. Schenita Randolph. If you could just tell us a little bit more about your origin story and where you come from and what shaped your journey into nursing and research.
Wonderful. Well, thank you. So I grew up in rural North Carolina. I like to joke and say that I was born in Brooklyn, but yeah, I was really raised in North Carolina. I grew up in rural North Carolina with my grandparents, who my grandfather was a farmer, and my grandmother's sisters was a nurse. And she had been a nurse for maybe 40 years before she retired into nursing. And so I really credit her and some of her stories around nursing as to why that was my career choice. When it was time for me to go off to college, one of my good friends that I graduated high school with was also going into nursing at A&T. And so that sort of led me into that career field. But once I got into it, community health really became my thing. Like I knew from my community health nursing instructor that, oh, community health is where it's at. And I just loved it so much. But at the time, you had to go to the hospital. Like it was a requirement. Like you had to work in the hospital a couple of years. And so I did that. But I always went back to my love in community health. And from there, went on to get my master's degree in public health. So it's just those concepts of public health and engaging the community in health promotion that has always been my passion. And so I got my master's degree in public health. My PhD is actually in public health. And through being a public health nurse in the clinical setting, I was in family planning and STDs and HIV and saw a lot of young people, communities of color that were coming in for STDs and repeatedly, like for testing, having to tell people, you know, your HIV test is positive. So it really gave me this passion to ask the question of what is really going on here and how can we find solutions to address these issues, particularly in our community, in the Black community. And so I've been doing this work. I've been a nurse for 26, 27 years, been in academia since 2004, and been in research, particularly at Duke. I've been at Duke since 2015. But that's sort of my journey of nursing, research, and why HIV.
Yeah. Yeah. Well, I mean, it's interesting how so much of where we grow up and who we grow up with, you know, makes such a difference in terms of where we find ourselves in our professional careers and how that motivates us into excellence, right? Because you have not just been your average nurse, you have not just been your average researcher. And that I think is, and in my experience working with you, is what sets you apart because you're so committed to and reflect back to your connection to and stay connected to your community and what their true experiences are. And I just admire that so much. Dr. Ragan Johnson, I could say some of the same things about you, but I would love for my audience to learn more about your origin story and how you came from where you started and how you landed in nursing and then eventually into research.
Yeah, so I'm from Memphis, Tennessee. And when I was young, my great grandfather he couldn't use his arm. I've told this story before, but he couldn't use his arm and found out that it was because he did yard work or something and a tree fell on his arm and the hospital would not treat him. And so it never set right. So he never had full use of that arm. And then my mom was like, I was born in the late 70s. I ain't gonna tell you the exact year. And I was born in a clinic because the hospital turned her away. So that I was gonna always do something in healthcare and health equity, right? So I thought I was gonna be a doctor, go to college, the Tennessee State University, and pre-med didn't work out. But I had a great advisor who shifted me to nursing and was like, you can do all of the things that you think you want to do as an MD, you can do it as a nurse and probably have a bigger impact. So that's what I did.
That's wonderful. I mean, a lot of people don't consider nursing in the same light as getting an MD or medicine, right? But we know better, right? And I'm so glad that your advisor encouraged you. I mean, your story is so amazing because a lot of people of our generation, Ragan, because I was born in that same part of the 70s, we don't think about our parents being turned away from healthcare. And, what that immediately makes me think about is maternal health equity, having to give birth at a clinic as opposed to a hospital. And then also it kind of makes me think about how things have shifted so much where more women, Black women in particular, are giving birth at home with doulas, midwives, nurses, things like that. So things have changed so much. And it also makes me think about how impactful and important our advisors are, our mentors are for our young folks, making sure that, we don't take no for an answer, right? And we get to where we're trying to go, despite what the circumstances might be. There's more than one way to get to your goal.
Yes.
So, and I know that both of you mentor young researchers, you mentor graduate students, things like that. Can you tell our audience a little bit about what that's like in this phase of your professional life, giving back to students that are searching for ways to make an impact?
Yeah, it is by far such a deep passion for me. So much. We have, along with 3 other colleagues, we created a program actually to address it. I'm a PhD prepared nurse, and there are less than 1% to 2% who are Black who have PhDs focused around research in nursing. And so we have co-created Black PhD nurse scientists, where we're trying to bring awareness to the role of the nurse scientist. We do HBCU tours. When we look at the historically Black colleges and universities, there are about only three that actually have PhD programs. And so as we're trying to address equity, we recognize the significance of, making sure that we are in that space too as leaders to be able to address equity based on our lived experiences, right? And the contribution that we have to that. And so I am so passionate about mentoring the next generation. I think so deeply because I know the people that were there for me and the impact that they had in my life. And I also know what it feels like to have no one there. Some of my experiences that I have experienced, particularly in higher education, I don't want anyone to have to go through and have to try to just figure it out on their own. I want to be able to, share experiences with them, make sure that they have the tools to be successful in their career trajectory. So I am extremely passionate, and I'll stop because I can talk about that for days. I love, love mentoring the next generation of nurses, nurse scientists.
Well, I want to say thank you for being there for our next generation of nurses and nurse scientists. And Dr. Ragan, I know that this is not new for you either. This is something that you do with a full heart. Can you tell our audience a little bit more about what that's like for you?
Yeah, kind of the same. So my advisor, I went to an HBCU, and I love HBCUs because you get that foundational confidence and competence that you need to go to the next level. So anyway, my same advisor who kind of pushed me into nursing also pushed me further in saying, like, you can be a nurse practitioner, you can do this. And she's like, I know people and I'm going to read about you one day. And that's what she told me. And so by the time I got to grad school at a PWI, and the language coming back to me was a lot different.
Mm-hmm.
I already had this foundation of who I was because I believed my advisor said I was. So I have a heart really for mentorship and being able to pour into people in a real way. You know what I mean? To be really someone's champion, like Schenita said, somebody's cheerleader and encourager so that they can go on. So we have a program too. LEAP is for current RN students at HBCUs to consider graduate level nursing. So to think more about being a nurse practitioner or being a doctor of nursing practice. So these are the things that we want to encourage through our mentorship as well.
Awesome.
Yeah. And can I just say that I think the theme in this is, as Ragan was saying, she went to a HBCU. I went to a HBCU.
I went to an HBCU.
Hey. There's an undeniable role that HBCUs play that contributes largely to this society. And I think bringing voice to that and acknowledging that is so important. And it's a culture, right? It's something that if you haven't experienced it, you really can't really define it. But it's so funny because we have a postdoc who has recently joined us, and we were meeting, and she was talking about the HEEAT Lab, and that's our research lab that Dr. Ragan Johnson and I have at Duke. And she said to me, she came from a PWI, graduated with her PhD, and her words were, I have so enjoyed being with you all at the HEEAT Lab. It's almost like I'm getting the HBCU experience that I haven't felt before.
I love it.
I said, no, wait a minute. I had to sit with that for a minute because I was like, I think that was a compliment.
It is.
Yeah, because it feels like home.
It feels like home.
Even though we're getting work done with excellence, right?
High excellence. So she feels like in the HEEAT Lab, she's getting the HBCU experience that she hadn't felt before at a PWI. So I was like, okay, I love it. Hey, I'm here for it.
If you're enjoying the show as much as we love creating it, consider showing your support by buying us a cup of coffee. Visit buymeacoffee.com/Niasha Fray O. That's buymeacoffee.com/Niasha Fray O. All one word. Each cup is just $5, and every single one helps us continue to produce, develop, and sustain the high quality content you've come to expect from Questions You Didn't Ask. Thank you for your continued support, and let's keep the conversation going. I'm so glad you did, because, one of the many things that I learned from being at FAMU is wherever you go, there you are, right? And so we bring Schenita, your leadership, Ragan, your leadership tells us, bring your whole self, right? And so that's the thing that we got from being at an HBCU, is that our whole self was valued, nurtured, educated, challenged, celebrated, right? And reprimanded when needed, right? Okay. Cause don't have one of your professors have to pull you aside. You gonna feel like you at home with mama and them. Okay. You gonna feel like you back home with mama and them. So, I think that it's interesting because one of the things about me, you all know I come from a psychology and public health background. And even though we have a lot in common in terms of our academic and professional and research experiences, I came to understand what public health was later in my career. I came to understand what a nurse scientist was later in my career. And I feel like because this is questions you didn't ask, I would love for you to share with our audience what your definition of being a nurse scientist is.
So they are definitely scholars who use the science, literature, evidence to ask a question and to solve that question.
Mm-hmm.
That's pretty much in layman's term. But it's based on methodology, it's based on the science of things, the evidence, building upon evidence that may exist, asking a question, developing interventions. Like for us, we are looking at Black women in HIV and recognizing that there's a gap in the literature, there's a gap in practice. And so the question becomes, how do we implement something that is socially and culturally relevant to be able to address this problem? And so through research, you're gathering that data and that information to be able to develop and create solutions. And particularly adding to the discipline of nursing. So as nurse scientists, you also collaborate with other disciplines in doing that. So that's the short answer of it. Having critical questions and creating solutions, not only for practice, but also for policy change.
Yeah. And it's interesting too, because Schenita, you come at being a nurse scientist from the perspective of a person that, as you mentioned, is trained as a PhD. And that is different than Ragan, your training, which is a doctor and nurse practitioner. Am I saying that right?
Doctor of Nursing Practice.
Yes. Thank you for correcting me. Tell us a little bit more about what that is and what it means in both clinical practice and research.
Yeah, so the DNP was brought about to be the practice doctorate, right? It to complement the PhD, the nurse scientist, and hopefully to be able to translate what's happening in research into the clinical space, right? That's kind of how it started. It's expanded over time to include quality improvement. So can you identify a practice problem, a practice gap, something that's happening in the clinic that needs to be addressed and improved? For instance, in nursing or in medicine, people get a really short education, right? And then they're out in practice. And maybe you don't get everything. Maybe you don't know about menopause. Yeah, I know I'm real big on menopause right now. Because I'm hot. But you don't get a lot of that in your training. So a nurse practitioner or DNP could go in and educate providers on improving care of people going through menopause.
Got you. So, I think that one of the things that I'm reflecting on too, in terms of my academic walk, is that, a lot of folks would say to me, if you want to do research, there's lots of different avenues that you can take to do research, right? If you want to be a practitioner now, that is a lot more specific. But some of what I'm hearing, especially from you, Dr. Randolph, is that when you get your PhD, right, and you have a nursing background, you can combine those things, right, to inform the types of questions that you're going to ask. And that's what I get from you as well, Ragan. But it seems like the DNP, the Doctor of Nursing Practice, I think I got it, is a lot more related to exactly what it says, how you practice nursing care in a clinical environment. And so the PhD is a little bit broader. The DNP is a little bit more specific. But what makes the HEEAT Lab so interesting is that you combine the two as co-directors for the HEEAT Lab. Can you tell my audience a little bit more about how that came about? What was the process and the strategy or even motivation for why that came about? And I'll start with you, Ragan, and just give you a chance to share what your insights are, just to switch it up a little bit.
I can't describe in words how great it's been to be able to partner and work with Schenita and learn from her and her work that she's doing and was already doing by the time I got there. She was already, on this trajectory. And then I started working at the same place, and we both had an interest in HIV prevention. We both had an interest in barbershops and beauty salons as kind of places to deliver information and health information. And so in that way, we were kind of put together a little bit by someone at the organization who thought we'd be, should have lunch. And we did. And then I think our spirits also kind of aligned and we had a similar heart. And so the magic was born.
I love it. And Schenita, I imagine that your recollection of how this came together is very similar. Are there any other things that you'd like to share with our audience, even about, how to innovate in this space through partnership, right? Through cross-discipline collaboration. Yeah. Why is that important even?
Yeah, the PhD DNP partnership and collaboration is probably one of the most powerful partnerships that can exist in nursing. I think we have opportunities to be a little bit more intentional about that. As Ragan shared, I think the stars just aligned. There were multiple things, but we have been a dynamic duo, and I say that unapologetically. When you think about research in general, it can take up to 17 years for research to actually translate, like the process that we go through in identifying problems, finding solutions. I got to do a pilot study. Now I got to do a pilot study on the pilot study. Then I got to do one more pilot study for the pilot of the pilot. It just, it can take forever. And so when you think about the DNP, there's that piece of translating this back into the clinical space. You think about the fact that we do community engagement. The questions that we ask, I think, are different. Some of our approaches are different, and they balance each other out to not sort of delay it as much as it typically is delayed. So this collaboration has been very powerful partnership in that. And Niasha, you asked me something else, honey, but I
will throw 10 questions at you at once. My audience knows that. I got to get better about that. But I think that you answered the essence of it, in terms of how you balance each other out, how having the PhD and the DNP helps to translate the research faster into practice, right? Because what we know about any type of health equity research or efforts at all is that we need it now, right? We need it yesterday. We need it tomorrow. And so just that alone is a major, major benefit to not just the research aspect, but to the community. And I think that that's something that's really important.
Yeah. And I think the other thing is that in everything that we do, like my focus may be on community and the women, right? And so we have this nurse-led model of care that thinks about the community, the clinical piece as well, right? And so Ragan has that lens of what is happening right now in clinical practice that's going to impact this community, right? What's happening right now with providers that's also going to impact this, because oftentimes we try to create things in this silo, right? Not realizing that there's a lived experience. There are really social determinants of health that impact. So I can create something, an intervention in the community, but that woman still has to go see her doctor, right? How do all of these things integrate? And I think that's the piece that I love about a PhD DNP collab, is that you're able to see it through the lenses of a real world experiences for the populations that you're working with. It's just amazing. Contact us for the blueprint, okay? I'm giving us all of our things. Nobody else is going to give it to us. I'm going to give it to us. We have done this, okay? So proud of us. Proud of you.
I love it. Ragan, anything you want to add to this dynamic duo description, so to speak?
Yeah, no, I think it's perfect. I do feel like we've been the blueprint. We've shown a successful template for how it can work. And thinking about research practice. And then also we tied in education too. Like, how do we prepare the next generation of nurses and nurse practitioners to be able to do what we're doing specifically, but also to be able to think about how you address practice in a way that you come up with your own questions that solve tomorrow's problem.
That was Questions You Didn't Ask, hosted by me, Niasha Fray. Thanks for joining us for Doing It for Ourselves, Black women, salons, and the science of health equity. If this episode moved you, share it, rate it, and follow on Spotify, Apple Podcasts, YouTube Podcasts, Audible, Amazon Music, or at rss.com and niashafray.com/podcast. Your support helps keep these conversations going.